So once I get a patient beyond the asking, why am I having problems with my erections? Because really there's no great answer. We can surmise why it's psychological versus physical. The end result is the same. You have to focus on success. If a man has performance anxiety, the cure for that isn't therapy. The cure is to succeed and have a solution where that you're confident with. If a man has a problem just because he's aging and he just needs a boost, the cure there, again, is to find a solution that succeeds. And the first step for a man is to decide that this is a problem that they can't have in their life, they don't want to have in their life. And we can always find a solution that gets a man an erection. The question is, how far along the line is the man willing to go to do that? So let's talk about the things that actually work. There are a lot of things out there that don't work. We'll talk about that separately, but what does work? Well, what mostly works, but not all the time, but usually are pills, like the most common ones being Viagra and Cialis. Other ones are Levitra, which isn't used much anymore, and Stendra. Now all of these drugs, fortunately, are generic. They used to be very expensive, $50 to $60 a pill. Now they're relatively cheap and easily obtainable. Sildenafil is Viagra. Tadalafil is Cialis. Vardenafil is Levitra. But we'll stick our discussion to Viagra and Cialis. Those work, but it's important to understand they don't always work. The worse your erections, the less likely pills will be an excellent solution for you. So the idea of a diabetic or someone else with a true medical problem that hasn't had an erection in 15 years, the idea they're going to take a Viagra or Cialis and it's going to work for them well, it's just non-existent. So that's an important thing. The perfect person where pills like this are going to work is the person who's at the earlier phases of erectile dysfunction, the earlier phase being, I'm starting to sometimes not be able to hold it all the way until I orgasm, or certainly maybe I can't have sex again till the next day, or I just don't have it. That's what pills are good for. I call pills the car amp. It's not going to make a new signal. It has to take the signal from the radio, but it amplifies that signal and gets the job done. But maybe all comers, maybe 70% will have success with pills. So that's important to understand. The other thing with pills that it's important to understand is that problems with your erections or erectile dysfunction or impotence, that's a progressive problem. So pills are going to give you a period of time where they work, and you may have to start with a lower dose and ramp up to the maximum dose. But after the maximum dose, there will be a point in everybody where the pills don't work anymore, and that's when we have to do things more aggressively. So when we get into things that are more aggressive, these are things that now it's a function of motivation. People have to decide, do I want to do these things? An old treatment, and I used to know a lot about this treatment. I used to be the national spokesman for the drug company, is called MUSE, MUSE. It stood for Medicated Urethral Suppository for Erection. This is hardly ever seen anymore, but this is a drug that causes the arteries in your penis to dilate. And the way it gets into your penis is through a small little capsule or suppository and an applicator, and you put it right up the end of your penis, your pee hole, your meatus, and it kicks out there and it melts. Now, I studied that in the setting of prostatectomy, and patients who I thought would be willing to do things like that. And even in that setting, it's not an effective means mostly. It works in about 20% of people. It would be the solution. It can work, but it can also cause significant pain, or it can simply not work. So to find someone where it works and there's no pain, that's about 20% of men. And each dose these days is still around $60, and it has to be refrigerated. So MUSE is something that's on the list beyond pills, but I don't use it very much for those reasons. The next thing that's readily available used to be pushed very hard when Medicare used to pay for these things as prosthetic devices. Now you just get it off of Amazon as something called a vacuum erection device, a VED. And what this is an Austin Powers thing. Austin Powers in those movies had this, and he would always hide his pump. What that is basically a vacuum. It's like a vacuum hose, and you put it over your penis, and it has to create a seal. And then you either pump it manually or you can have an electric pump in the fancy Cadillac versions. After you do that, it's sucking blood into your penis from negative pressure. Then you have to put a base around the bottom. So it's this tight rubber band. So this isn't optimal, and it's not one of those hard, hot erections. Women will feel this to not really be as hot as it's supposed to be. And they'll say, what's going on here? It's cold. Your partner may not like this erection. It's because this is venous blood. This is not arterial blood. And it's a little clunky. Imagine going on a date, meeting someone on a dating app for the first time, and then pulling this thing out. And then, the whole time you have this band around the base of your penis. So this is good for some people. This is not as good as some of the other things we're going to talk about. You have to be really in a committed relationship to use one of these things and not be embarrassed by it, but they're readily available on Amazon. And the next option we talk about involves needles. So some people just say, I won't go there. And those are the people that may be interested in something like a vacuum erection device. The vacuum erection device also, I should point out, is there's some claims out there that are false claims that using these things will make your penis longer or bigger. That's BS. Don't believe those claims. That's not what those things are good for. So then the next thing up the food chain here, the next thing that does work, we've talked about pills that usually work. We've talked about MUSE. That's not a great solution. Vacuum devices that are clunky and not always feasible or reasonable. Injections are the next step. So injection sounds like a terrible thing. What you're going to do is actually take a needle that is very similar to a diabetic drawing up his medicine and inject that into the side of your penis. And it doesn't sound like anything anyone would want to do, but millions of men do this. You may or may not realize this, but when you hear ads on the radio or elsewhere or in a newspaper for a men's health clinic where they guarantee success with something or your money back, they're talking about injections. So this is actually quite common. You just maybe never heard of injections. And it's very easy to do. I always say, you never heard of a heroin addict that complains about the needle because they're getting pleasure from the experience. Well, that's what happens with someone that does injections. You get over the first one. We teach you it's a tiny needle and then it works. And the way it works is it can be quite spontaneous. You can go on a date, meet someone for the first time. They wouldn't necessarily know you've done this. You go to the bathroom, you inject, you come out and it starts getting hard right away. This is an advantage over pills that takes maybe an hour or so. Or 30 minutes at least to get hard. Even the preparations that you see under the tongue, there's some time involved. With injections, there is not much time involved. And you'll come out and start getting hard right away, kind of like a teenager. There's some learning to be done. We have to teach you how to do injections. You don't just get them and do it on your own because this can put you in an emergency room if you have too much. But you titrate yourself so you have a rock hard erection that lasts as long as you want it to last, but not too long. And so for many men, erections is the solution. That is the next step, typically, if you want something that definitely works after pills. And then the final solution, which should be, in my opinion, someone who has already moved through the other options, would be a surgery called placement of a penile prosthesis. And the standard penile prosthesis largely works like this. Your penis you can think of as a triple-barreled shotgun. So you have two barrels of a shotgun and then a third underneath. Let's not talk about the one underneath. You urinate through that one, but the two up top, what happens is your brain says, I'm horny, I want to get an erection. It sends messages to your spinal cord. Your spinal cord tells your penis, open up the floodgates, dilate all the arteries, and get blood into those two, what we call corporal bodies. And then there's special tissue in there that traps that blood, and the veins, you can see them on your penis, are on the outside. So as that gets hard, it pushes on the veins and creates its own internal tourniquet. That's how you get an erection. So injections are forcing that blood flow into those corporal bodies. But what a penile prosthesis is we're going to make an incision so that we can actually hollow out those corporal bodies and insert a prosthesis into each of those bodies that doesn't fill up with blood. It fills up with water. It fills up with salt water. So Because of that system, the engineering behind it is such as there has to be a pump to pump the water in, and that's a pump that we implant into your scrotum. And there has to be a balloon to hold the water that can be put either behind your pubic bone or up under the muscles you would use to use sit-ups. But either way, all of it is internal. You don't see the balloon at all. And that's a very, very reliable approach, but it is surgery. There are complications with it. So you don't get talked into one of these. This isn't just something you do on a whim. This is something because you say, I've tried everything else, or I just can't handle the needles, or it's just no good for me. And I'm ready to do this. Once you do this and once you recover, this is the highest satisfaction rate. It works. It works reliably. You can always count on an erection with a prosthesis, and it will always be what we call blue steel or hard as a rock. So that's sort of the top of the food chain is the penile prosthesis, but it's something you do if other things fail.